All right, the CDC is warning about a deadly fungus that is spreading across the United States. It's affecting healthcare facilities for the most part, such as hospitals and nursing homes. The fungus, which is called Candida auris, or C. auris, is drug resistant. If infected, it can cause severe illness for those with weakened immune systems, and it can even be deadly. Here to discuss drug-resistant bacteria and superbugs more broadly is Captain Arjun Srinivasan. He's the Deputy Director for Program Improvements for the CDC's Division of Healthcare Quality Promotion. Doctor, thanks so much for joining us.
Thank you so much for having me. Good morning.
So I guess the first question is, how concerned should Americans be about antibiotic-resistant infections?
You know, I always tell people this is something that it's a cause for concern, but not panic. This is an important problem, right? We know that every year in the United States, about 3 million people will get an infection with a bacteria or a fungus like Candida auris that you were just talking about that is resistant to the main antibiotic or antifungal that we would like to use to treat it. And that's how we simply define antibiotic resistance. So it's common. About 35,000 people per year will die of those infections. So this is a very, very important problem. It's a concerning problem that impacts the lives of millions of Americans. Odds are you or someone you know has had experience with one of these drug-resistant infections.
Give us a really basic science lesson here. What makes a superbug resistant to antibiotics?
Yeah, you know, antibiotics are like any other, bacteria and fungi are like any other living thing, right? They have the desire to survive. And the way that they do that is they develop mutations. So when we expose them to an antibiotic or an antifungal that's designed to kill them, over time, some little population through random mutations will become resistant to that agent. And what happens is that, you know, bacteria have strength in numbers, right? There are billions and billions of them. So the chance that one of them is going to develop resistance to one of our antibiotics becomes higher and higher. And the more we use those antibiotics, the more we expose bacteria and fungi to these agents, the higher the chance that that resistance will develop and then grow and then spread becomes. And that's quite simply how it happens. So this is kind of an evolutionary thing. There's nothing we can do to stop resistance from developing, but there's a lot that we can do to slow it down. And that's really what our efforts are focused on. How do we slow the development of resistance in both bacteria and fungi?
So one of the things, Doctor, you'll remember that we were all doing and recommending in the early days of the COVID-19 pandemic before we had vaccines was telling people to wash their hands and to wash them well and to
sing happy birthday.
Right. You at least 20 seconds while you're washing your hands, right? But it's my understanding, and correct me if I'm wrong, that bacteria are even resistant to washing and scrubbing. So in this particular case, when we know that they're resistant to antibiotics, what can people do to protect themselves? Would washing your hands, if you came into contact with this bacteria, would that help at all or not at all?
Yeah, I'm so glad you're asking this because absolutely. Washing your hands, it turns out your mom was right. The most important thing that you can do to protect yourself, to protect those around you, your family, those you love, your friends and family, is washing your hands. And there are some rare types of bacteria that can be hard to clean with the alcohol-based hand rubs, right? And those became so popular and so ubiquitous during COVID, and they're great. They work against the overwhelming majority of everything that we encounter, especially outside of hospitals, right? So there are rare instances when in a hospital, we will tell people, rather than use an alcohol hand rub, we want you to actually wash your hands with soap and water. But washing your hands with soap and water, scrubbing, singing happy birthday, that works against all of these threats, right? So I think I'm so glad you asked this because we really want people to understand outside of healthcare settings, alcohol and hand rubs, if your hands are not visibly soiled, if they don't have, you know, dirt or something on them, alcohol hand rub is fantastic. It will protect you against pretty much everything outside of healthcare settings. There are rare instances in healthcare settings when we recommend hand washing over alcohol hand rub, but hand washing is always the right thing to do.
Captain, I'm curious. I feel like it's like every so often we have a conversation like this.
Yeah.
Is this sort of thing cyclical?
No, it's not. And I again, I think that's a really important point you're raising. I think it garners attention every now and then, right? Something dramatic will happen. There'll be a new superbug that emerges, and we're seeing that now with Candida auris. But it's not a cyclical problem. It's not like it went away when people weren't paying attention to it. This is a problem that has been rising in the United States and around the world for many, many years. And it's something that, we have been working very hard to get people to pay attention to get people to take action on. And the good news is that those efforts are paying off. Before the pandemic, we actually saw reductions in the number of these antibiotic resistant infections that were happening in healthcare settings. And that's incredibly encouraging news. It demonstrates that when we apply concerted effort and keep our foot on the gas, we can make an impact against these pathogens. The problem is that we lost a lot of that progress. In fact, almost all of it during the pandemic. And so now, now is the time we have to redouble our efforts as COVID begins to recede. We have to redouble our efforts to address these antibiotic-resistant bacteria. They are not going anywhere. They are only going to become a bigger problem unless we reinvigorate those efforts to combat them.
All right. Captain Arjun Srinivasan, thank you very much.
Thank you so much for having me.